right, good afternoon, everybody. Thank you for joining us. Welcome to the session of the orientation for the Appalachia Region Healthcare Technical Assistance Center. Before we get started, I just wanted to give a quick moment to go over a few housekeeping items. You may have noticed that you are all on mute, and this is just to avoid background noise. When possible, we ask that you use the webinar link to log in rather than using the call-in option. This will ensure that you will have the best audio quality experience. We do encourage you to ask questions, so please feel free to use the Q&A feature. You can find that at either the top or the bottom of your screen, depending on your layout. If you need closed captioning, that is available. To access closed captioning, click More with the 3 dots at the top of the screen, then select Language and Speech, and then choose the transcription option for closed captioning. Regarding how to access this webinar, once we've concluded the call, we will send the slides to all attendees within 1 week of the event. This recording for this webinar will also be on our website, ARH-TAC, within 1 week of the event. Last but not least, if you have follow-up questions, you can reach out to us at any time at ARH-support@ARH-RCO.org. Now I'll hand over to our Director of Programs, Anna.
All right, welcome everybody. It's our pleasure to provide you with an introduction to the Appalachian Region Healthcare Technical Assistance Center. We will discuss the eligibility and the requirements for application, as well as the technical assistance services available for qualifying facilities. Together we'll share who we are and how the Rural Health Redesign Center will provide guidance on this program. Before we close out our session today, we will provide resources and education needed to better understand the application process, including the timeline for application submission and award notification. But before we begin, we want to acknowledge that the work of the Appalachian Region Healthcare Technical Assistance Center is funded by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. So I'd like to introduce you to our team here at the ARH-TAC. I am the Director of Programs. My name is Anna. I am a nurse and a rural health leader. I will be your moderator today. Sue Pascarella, who you've just met, is the Program Director, and Sue has 35 plus years experience in rural health care. Sue previously was a Director of Physician Practice within a rural healthcare system and managed rural health clinics, working closely with hospital leadership to enhance service line development. Sue is a certified rural health clinical professional through the National Association of Rural Health Clinics. She's been with the HRSA since 2022, working with social determinants of health within the rural communities, as well as serving as the Program Director for the Workforce Grant within Labor and Industry to look at EMS and community health worker services within Somerset and Armstrong counties in the state of Pennsylvania. Suzanne Snyder is a public health analyst in the Hospital State Division in HRSA's Federal Office of Rural Health Policy. Since 2020, Suzanne has led the administration of the Delta Region Community Health Systems Development Program, a technical assistance program providing in-depth support to rural hospitals and clinics in the Mississippi Delta region. In 2024, Suzanne led the development and implementation of the Appalachian Region Healthcare Support Program aimed at enhancing financial sustainability for hospitals and clinics in the Appalachia region. Suzanne also serves as a project officer for the state offices of rural health. And Daniela Powers is our project manager here at the ARH-TAC and holds a Master's of Science in Nutrition Education and was born and raised in Appalachia. Danny has dedicated her career to the advancement and empowerment of underserved and underrepresented populations in the United States. We are very pleased to be here with you today. Our speakers today include Janice Walters, Executive Director of the Rural Health Redesign Center organization. Janice is a visionary leader in rural health and has over 2 decades of expertise in healthcare finance and executive leadership. She collaborates seamlessly with rural health executives, both state and federal programs, and community partners to revolutionize healthcare access in rural communities across the United States. Janice has spearheaded groundbreaking initiatives at the Rural Health Redesign Center, including the pioneering Pennsylvania Rural Health Model and the cutting-edge Technical Assistance Centers for the Rural Emergency Hospital and the Northern Border Region Healthcare Support Programs. We are also pleased to have as our guest and partner from the Federal Office of Rural Health Policy, Rachel Moscato. Rachel is the Director of the Hospital State Division in HRSA's Federal Office of Rural Health Policy. In this role, she provides strategic direction and oversight for the division's $92 million portfolio of national grant and cooperative agreement programs focused on improving access to quality healthcare in rural communities. These programs include the Medicare Rural Hospital Flexibility Program, the Small Rural Hospital Improvement Program, the State Offices of Rural Health Program, and HRSA's suite of Rural Hospital Technical Assistance Programs. In 2024, Rachel oversaw the development of the Rural Hospital Stabilization Pilot Program and the Appalachian Region Healthcare Support Program, 2 new programs focused on long-term financial sustainability for rural hospitals. We all have one more guest, and that is Lauren Wood. Lauren is a health program manager at the Appalachian Region Commission, a federal state economic development partnership serving the Appalachian region. She oversees ARC's health portfolio, including the Inspire SUD Recovery to Work initiative. Lauren holds a Bachelor of Science in Family Studies and Human Development and a Master of Public Health from the University of Arizona, as well as a Bachelor of Science in Nutrition and Dietetics from Metropolitan State University of Denver. At this time, we'll welcome our HRSA partner, Rachel.
Thanks, Anna. And thank you all for being here today. I am so excited to be part of the launch of this new program. This is something we've been developing and building for the better part of 2024. So we're excited to be launching it to all of you today. I did just want to provide some high-level context of sort of how the program came to be and where we're going with it. This kind of comes out of the need that we've learned through the administration of our suite of hospital technical assistance programs over the years. We've really recognized a strong need to bring programs to hospitals that can help with expanding services, building what you already have, and really helping to build in that long-term financial and operational sustainability. Ultimately, enabling you to provide high quality care to the rural communities that you serve. So with the fiscal year 2024 budget, we received support for this program. And, I really just want to share a huge thank you to Congress for really recognizing the needs of rural hospitals in the Appalachian region and then providing us with the funding to meet those needs. We know the need is great and there's often more than we can support, but it's nice to be able to have that recognition and start with this program. So our goal here is really to provide healthcare organizations in the region with expertise and consultations from some of the top folks in the nation that work on rural hospital finance and quality. All of this is designed to be brought to the hospitals and healthcare organizations at no cost to you. So all of this is provided by the federal government through the Rural Health Redesign Center. So, what that means is that you'll have access to experts who are really going to help you identify areas where you can look and build services and really improve your finances and operations for the long term. And then, as we've sort of already talked about, all of this is done in collaboration with the Appalachian Regional Commission, who we are thrilled to be partnering with on this, as well as the Rural Health Redesign Center, who administers and does all of this work on behalf of HRSA. So, in a few minutes, we'll turn it back over so that you can hear more both from the Appalachian Regional Commission as well as the Redesign Center on how the program would work for you and your community. And just before I turn it over, because, we know there's a huge need out there, I do want to just mention we have several other rural hospital technical assistance programs that we work with in our office. If you'd like to learn more about them, we have an inbox that you can reach out to. It's Rural Hospitals at HRSA.gov, very simple. You can send a note to that if you're interested in learning more about any of our other programs, and we would be happy to share more info with you. So again, just thank you all for your interest in this program. We're thrilled to be here and looking forward to seeing how it goes. Thank you.
All right. Thank you, Rachel. And now we'd like to welcome Lauren Wood.
Yes, thank you very much to Rural Health Redesign Center and certainly to HRSA. Appreciate your partnership and your thought leadership in this space, and certainly the technical assistance you're going to provide to our Appalachian communities. So as I start to kick things off here, for those of you that may not be familiar with who or what the Appalachian Regional Commission is, so we are a state and federal economic development partnership agency, so kind of oddly sit within this quasi-federal government position, but we encompass most importantly the 13 states, 423 counties, and the 26 million people that call Appalachia home. We were created back in 1965, and our mission is really to innovate, to partner, and invest to build that community capacity, and of course, strengthen the economic growth in our region. So we invest also across 5 very broad focus areas. Those are businesses and entrepreneurs, workforce ecosystems, critical infrastructure, culture and tourism, and leadership and community capacity. And the reason why I bring that kind of top of mind in the next few slides that you'll see is, as obviously you all are all things, community, rural health, but as you or your partners in your communities, regions, and states within Appalachia have ideas and potential, projects that you would be interested in having ARC fund, I encourage you to reach out to myself or anyone else at ARC to start having those conversations about funding pathways. Again, I'll get into that here in a couple slides. But first and foremost, so my passion set, I'd be remiss if I did not mention, especially as it relates to you on kind of building this rural health capacity, but I'd be remiss if I did not discuss our INSPIRE, so Investment Supporting Partnerships and Recovery Ecosystems Funding Initiative. This is up to $13 million. It's been around since about April of 2021, so we're a few years in at this point, but it is really all things substance use disorder and behavioral health workforce funding. So it also just went live to the public on this Monday, January 13th. So a few key things to note there is that LOIs are going to be due, but letters of intent are due February 14th, and then final applications are going to be due March 10th. I just recently learned how to use a QR code, so hopefully you can scan that QR code in the bottom right, and that's going to take you directly to the FY25 NOSA. But really, top line here, the foundation of all things INSPIRE and the projects we fund really places a strong emphasis on building those substance use disorder coalitions and partnerships. Of course, implementing evidence-based practices, right? Paying for what works, not for what doesn't. And then a kind of renewed interest in the FY25 NOSA is going to be research and evaluation on, your programs and your projects, especially as it relates to kind of building, improving and expanding recovery-ready workplace models, as in the last few years championed by the Biden-Harris administration. Along the same lines of the substance use disorder work, because this is, another big funding package that we have, but ARC, in addition to our partners at the Development District Association of Appalachia, so essentially it's a nonprofit that manages all of our local development districts and workforce development boards across our region. We created last year a toolkit, if you will, but a builder's guide to kind of walk a community and folks like yourself through a self-driven process to start or expand those regional SUD, ecosystem work. So there's 5 phases within the guide, all really practical resources. They've got templates and all kinds of case studies and community spotlights and things of that nature, again, to help communities like you and certainly your partners really navigate a lot of that ecosystem development and address the many barriers that individuals in recovery face in accessing, transportation and housing and workforce. And then also there's additional emphasis on that social, medical, and the behavioral health workforce that supports that recovery population. And my favorite slide of all, because this is funding available to our 71 folks that are on today's webinar. So for those that are interested in accessing, right, the many federal funding streams that are out there, there are a number of additional ones outside of Inspire that ARC boasts. So we also have our Power Initiative. That's actually going to go live here in about 4 weeks to the public. That one's really focused on coal impacted communities. Again, going back to that 5 broad focus areas or investment goals that I had mentioned in the second slide, the workforce and education and community capacity and leaders. So Power really focuses on all of those. Those grants are up to $2 million. We then have ARISE, that's our largest funding package, with implementation grants being up to $10 million and planning grants up to $500,000. ARISE is truly transformational in nature and requires, at minimum, in order to be competitive, 2 states in order to apply for that funding stream. We also have our area development funding. Now, this is going to be our most flexible line of funding. It's very state-based. So in order to access that level of funding or that type of funding, interested applicants need to reach out to their respective state program manager. When you get these slides, I've linked all of the state program manager contact information there. And then lastly, we have our newest funding initiative called Ready Appalachia. This is really focused on building out capacity or community capacity across 4 different subgroups. So you've got your local development districts, nonprofits, local governments, and community foundations. And then as of actually just yesterday, the Ready nonprofit funding cycle plus a technical assistance component to that is live, and final applications for that Ready nonprofit is due February 28th. I know I ran through some of that very quickly, but again, my contact information is here as well as the general ARC website. Again, just want to give a huge shout out to everyone that's on today and very interested in this TA. By all means, feel free to contact me for additional lines of funding for your Appalachian communities. And most importantly, thank you, HRSA and Rural Health Redesign Center.
Thank you, Lauren, for that wonderful information. And we do have Lauren's contact information here on this slide. So thank you once again. And at this time, we'd like to welcome Janice Walters.
Thank you, Anna. Welcome, everyone. I find it fascinating just listening to all of the various opportunities that are out there to really help our Appalachia region and improve health within those regions, as well as workforce, economic stability, and all of that. So for the next few minutes, I am going to take you through basically what we can offer here at the Rural Health Redesign Center. I'll introduce you to the organization, who we are, just at a really high level, and then we will jump in and do a deeper dive into how the TA program will work within the Appalachia Technical Assistance Center, so you have an understanding of what to expect. So who are we? If you're not familiar with the Rural Health Redesign Center, we are an organization with a mission to protect and promote access to healthcare for not only residents of the Commonwealth, but also across the country. And our approach to achieving our mission is really to think about innovations within the rural healthcare delivery system to really, I would say, improve upon the fee-for-service infrastructure and really bring innovative solutions to meet some of our biggest challenges. Our overall vision of the organization is to really help rural communities thrive through improved health. And so we know healthcare is an important component of health, but we also know improved health is far bigger than just healthcare. And so just tying back to some of the comments that Lauren made there and some of the things that they're looking to achieve through the Appalachian Regional Commission there, it's really about broader than just healthcare. We're fortunate enough to be working with healthcare organizations within this specific grant, but we certainly know in order for us to achieve our vision as an organization, it goes much beyond healthcare if we want our rural communities to truly thrive. As we think about the specifics within the Appalachian Region Healthcare Technical Assistance Center, what is the purpose of the program? And so we really wanted to pause and be very straightforward with the overall purpose. And so this content was taken directly from the Notice of Funding Opportunity. And I will read it. The Appalachian Region Healthcare Support Program provides technical assistance to help rural healthcare organizations, including critical access hospitals, small rural hospitals, rural health clinics, tribal healthcare facilities, and other healthcare organizations located in the rural counties served by the Appalachian Regional Commission with planning and implementing healthcare service improvements. So again, highlighting here who's actually eligible. We'll touch on that on another slide. But eligibility really comes back for critical access hospitals, small rural hospitals, rural health clinics, tribal healthcare facilities, and other healthcare organizations. The overarching goal of what we're trying to achieve is to strengthen healthcare delivery in rural areas throughout the Appalachian region, with an overarching aim to enhance and expand new service lines to address local medical needs, increase service volume and revenue, and ensure continued healthcare services in rural areas. This map shows a generalization of who's eligible. I believe this is also shared on a prior screen by Lauren. But regarding those who are eligible to apply to receive technical assistance, healthcare organizations, again, to repeat, including critical access hospitals, small rural hospitals, rural health clinics, tribal healthcare facilities, and potentially other healthcare organizations may apply. These organizations must be located in the HRSA-defined rural counties served by the Appalachian Regional Commission across 13 Appalachian states, which is parts of Alabama, Georgia, Kentucky, Maryland. MS is escaping me. Help me. What's Mississippi? Mississippi. Thank you. Sorry about that. New York, North Carolina, Ohio, PA, South Carolina, Tennessee, Virginia, and all of West Virginia. If you're unsure about your eligibility, you can check these two websites. So at the bottom of the screen, there's two website links that you can check to see if you're listed and eligible for service. So I draw you to your attention to the links at the bottom of the webpage. And again, these will be sent out post webinar, so you will have access to this information. So what we plan to offer and our program is to support 6 recipients. And so what you will receive from the Rural Health Redesign Center through the Appalachian Region Healthcare Technical Assistance Center is individualized, tailored TA to help identify areas for operational improvement and capacity building. That also will include service line and community assessments to identify potential expansion opportunities, with the opportunity to provide seed funding for service lines where ROI indicates there is identified opportunity. In addition, we'll offer coaching and monitoring for your organization to implement best practice recommendations. If you're interested and want to understand how to apply for these services, the journey really starts with just an introductory call. So if upon completion of this, you think, man, I'd really like to learn more about this opportunity, we would request that you reach out to us by email or phone so that one of our team members can just schedule an introductory call. As part of that introductory call, it's really just going to be a conversation. Our goal is to understand you as an organization, and then post that, we'll determine, again, mutually with you as part of that conversation, if we think there's benefit that we could provide to you. And if that determination is yes, then we will send to you a brief intake form asking for just some key information that will actually then be used in the selection process. So our goal is to use objective data to identify those hospitals that can really benefit from TA. Certainly understanding the runway and understanding your needs is very, very important. And so some of the key indicators that we ask for information to be sent to us will actually then help us score the application, because this is somewhat competitive and in the sense that we're charged with working with 6 organizations. So again, first step, introductory call. Second step, we'll send you an intake form. We'll use that information in partnership with HRSA and the Appalachian Region Commission. We'll look at that information, and then we will notify selected organizations by the end of February. So some key dates to know. It is a relatively short turnaround time. So we are looking for interested organizations to reach out near term. So please, follow up with email, follow up by phone to connect with our team. The webinar here today is the start of the process. The application deadline is January 30th. And so all applications need to be submitted by January 30th to be considered for this first round of funding, this first year of participation. As stated, we will do our best to turn that data, turn that information quickly, and provide notification to all applicants on whether they've been selected or not. I do want to make the point, and a very, very important point, that if you miss these dates, for one reason or another, you don't get the slides or you're notified, after these deadlines, we would certainly encourage you to still reach out to us and have a conversation. As has already been mentioned by Rachel earlier in the webinar, there are other resources available. There are other technical assistance programs, and certainly our goal would be to connect you with them. So if we're not able to help you within this particular technical assistance award, our goal would certainly be to connect you with other resources that might be available. So again, even if you miss these deadlines or this timeline, please do reach out to us, because we would certainly want to help you get connected to broader resources that might be available to support you. So if you were selected, what might this look like for you? And so, this is really just to be illustrative of the journey that we would take you on through our TA center. The program is expected or anticipated to last about a year, but step 1 is really planning and getting to know you, your organization, your individual needs, as well as the needs of your community. So most of our team here at the Rural Health Redesign Center have lived rural and have a lot of rural relevant work experience. A lot of us worked in rural hospitals. And so we certainly understand resource constraints. We certainly understand what it means to have a vision for the future, how difficult it is to have a vision for the future, to think about sustainability long term while you're struggling just to keep your organization open day to day. And so our approach to TA is very, I would say, tailored to you, the needs of your community. We have a lot of resources that we can provide, but we certainly want to provide the resources that are the most meaningful to you and your community and your organization. And therefore, step 1 is really planning and discovery. We also, our approach is very tailored, it's individual. But also we have opportunities for group education. But one of the things that we do offer through the TA Center is an individual coach or liaison, as we like to call them, that will really walk with you on this journey. We really do see this as a partnership, and we try to provide that individualized support, not only through the programs that we offer, but also by giving you somebody that's your coach, your liaison, your contact person. And so that's also part of the journey. You would have that coach, that liaison that would guide you throughout the course of the year. As I've already talked about, getting to know you and your organization, part of what we offer is also assessments, identifying ways that we can optimize, your current operations through various assessments, including, service lines assessments, financial assessments, quality assessments, workforce, cultural, lots of assessment tools. So if you reach out to us and really don't know exactly what you need, we can help you determine that and help you identify improvement opportunities. And then last but not least, any of the things that we find, we would then want to put together an actual implementation strategy. So our goal is not just to identify what you need, but also then work with you to address and implement and help you identify how. So it's one thing to know what you need to do. It's another thing to know how to do it. And we walk with you to try to identify and put together pragmatic implementation plans, formalized plans, etc. So I've already briefly touched on a lot of this, but things that you can expect from us here at the TA Center. Like I said, we offer a wide array of technical assistance. Just highlighting some of this for you, but education, we certainly work to ensure that your team has the educational resources that they needed. We offer a wide array of educational resources and topics. I already talked about the one-on-one regional liaison and relationship partnership support. So, a coach to help you on this journey, help you identify maybe where to start and align your needs with our resources. Performance improvement and quality improvement. So we have a number of folks on our team that have formal training on performance and quality improvement. And so not only are we looking to help you identify service expansion or service optimization opportunities, but we're also looking to help you identify ways to just improve your overall performance, operational infrastructure, etc. I've already touched on this a little bit. We do also look at your community needs, identification, identifying, social drivers of health burden, as well as chronic disease burden within your community to actually help inform your service line expansion opportunities. And as I've also mentioned, really that planning and implementation support to make sure that, again, we're not just showing you what needs to happen, but we're actually walking with you to help you put together a pretty pragmatic and common sense implementation approach. How we approach our work, I think it's very important that you understand our philosophies. One of the things that we commit to do within the Rural Health Redesign Center is to respond quickly to any direct inquiries or outreach to our center. Our goal is to provide a response within 24 hours of outreach. That does not mean we will always have the answers for you within 24 hours, but we do make a commitment that you will hear from us. And at least we acknowledge that we received your inquiry and our teams are standing by ready to implement. So if you reach out to the ARH support line as identified on this slide, we make a commitment that you will hear from us rapidly and we begin that intake process, that application process very quickly. Even outside of a formal application, the same is true. If you reach out to us through any of our support lines, we make it a commitment to do our best to respond within 24 hours. We also provide objective analysis and assessment of healthcare organizations. That includes financial analysis, market share, quality indicators, revenue cycle, human resource, cultural assessments, etc. But again, our goal is to provide objective analysis, and really we try to provide you the information that you need to make objective decisions as healthcare leaders. I've already touched on this. We also provide rural relevant subject matter expertise. Again, a number of us actually have helped run hospitals, CEOs, CFOs, chief clinician roles, etc. And so we know what our healthcare organizations are experiencing. Many of us were in those shoes at one point, and so that helps inform our guidance and support to you. We also work to identify clinical areas and expand service lines. So I already talked about that. We have a lot of robust tools that we can bring to you to help identify where you have opportunities. And then again, we support the implementation, the identification, as well as implementation, and then ongoing support through market and stakeholder engagement. So one of the resources we do have available that wasn't visible is marketing support. We certainly know that a lot of our hospitals struggle in the marketing area, but we do have tools and resources that we can bring to bear for the awardees that can actually help you in the marketing, as well as bringing other stakeholders to the table. So that's an overview of what we will do for you through the TA Center for those that are successfully awarded. However, for any partnership to be successful, it has to be a two-way street. And so we wanted to put in front of you today, in order for us to be successful, to help you, what we need from you in return. And so what would be expected of awardees is a commitment from their board of directors and leadership to fully engage and embrace the journey that we will be on together over the next 12 months. We would be asking that you do commit the resources of staff to support the work. And so again, we certainly identify and understand that all of you are very, very busy. And as we put together our implementation and our TA programs, certainly we want to do so in a pace that's palatable for you to execute. And so we would work with you to identify that, but then we would also be asking for you to make sure you have the committed resources in order for us to be successful in the partnership. We would also ask that you supply accurate information. So we can only help if we get accurate information provided to us. And so we would certainly be asking that you, when on your forms and the intake material that's sent in, as well as, on the journey, that you be sure that you would be sure to give us accurate information. And then similarly, as we're communicating or committing to provide a timely communication back to you, we would ask the same, that timely communication and response. So these are our expectations, that in order for a partnership to be successful, it really does have to be a two-way street, and just that commitment to resources, commitment to success, accurate information, and timely response and communication. One of the things we did want to make known as well is we are in the process of standing up a technical assistance advisory council. So we certainly do not have all the information that we need here at the Rural Health Redesign Center to help inform this work. We know there are a lot of other experts in this region. And so really looking to leverage the experts in the region to provide insights into our work and support the work of the Appalachian region TAC. And so the goal or the work of this Technical Advisory Council, as you can see on the screen, is really offer guidance and insights to support the work of the TA Center. Guide and advise the RHRC in cooperation with HRSA in terms of how we might consider making changes to the administration of the program. More importantly, activate networks across the Appalachian region. So again, all of these folks that are coming to the table to serve on this council have robust networks of relationships, and it really does take a full community if we want to put our hospitals on a path to sustainability. It's not anything that one organization can do independently, but it really does take a robust community of stakeholders across the ecosystem. And so that'll be a big role of these members, is to really help us activate that network of resources. Obviously, review and provide feedback on issues and concerns, as with anything new. And as we start this process, there will be learning along the way, and we will be looking to this committee or this council to actually help guide us and problem solve where it might be needed. The goal is to convene this group quarterly. Again, to achieve the objectives and really get the input that we believe we need the TA Center to truly be successful, have that input of other experts that live in this region. Pulling the group together quarterly is the current plan. We're currently wrapping up who's going to serve on this committee. And so we've had 6 folks commit, and we're sharing the names and the organizations of those 6 individuals with you today. We do have some more invitations out to some other folks. And so we are still awaiting some of those responses, but really wanted to get in front of you the knowns as of today in terms of who's going to be sitting on this advisory council. And the various areas of expertise and organizations that will be representing and having a voice on this committee. So again, stay tuned. More information to come on this, but we certainly wanted to give you insight that this is nothing that we are doing independently, but we welcome the voices of other experts across the Appalachian region to really help us move forward with the overarching goal of really helping our rural communities to thrive. So with that, I've come to the end of my formal content, and I will turn it back to Sue, I believe, to moderate the Q&A portion of the program. Thank you.
Thanks, Janice. We're going to pause now for some questions. We'll start by reviewing the questions submitted to us via the registration process that have not already been answered within the presentation, as we looked at those questions prior during the registration process, just so that we could make sure that we could address them all. And then we'll go over some questions submitted via the Q&A function. So one question that we had come through was, are health departments that run designated rural health clinics eligible for this program? And we would like our HRSA partners, either Suzanne or Rachel, to be able to speak to that.
Yeah, thanks, Sue. This is Rachel. I'll take that question. So ultimately, this program is really designed to provide technical assistance directly to the healthcare facilities. So a health department would not really necessarily need to apply. However, the rural health clinic, a hospital, the actual healthcare organization would be the eligible entity that would want to apply for the program.
Thank you, Rachel. One other question that I'm going to have either you or Suzanne answer is, would this funding be available for FQHC pharmacy that needs to relocate due to the building and patient access restrictions? This would allow for a drive-through pharmacy to be established and parking close to the entrance for easier patient access.
So this sounds like it may be asking if if the program can support some of those building costs. And the answer is no, this is not a construction program. That's a very specific type of federal funding. And this program is really focused on providing that direct technical assistance support that Janice walked through to really help with the financial and operational pieces.
Great, thank you. I have not seen any questions come through the Q&A as of yet. I do want to let you know that if after this presentation you do have questions, you can always reach out to us at that support line, that ARH support line, and we are happy to answer those questions through that. And if we don't know or we need to pull in HRSA or ARC, we will certainly do that to get those answers. And as Janice had mentioned, our goal as part of the RHRC has always been to be very timely in our responses. So we may not know the answer, but we will certainly make sure that we let you know that we received the question and we are looking into the answer for you.
Hey, Sue. If you don't mind, can I go back to the question on the pharmacy possible construction or infrastructure development? Whoever asked that, if that person wants to email me, that would be very squarely in ARC's funding parameters. So happy to discuss offline any of that with them and get the project scope and funding ask, and we can take it from there.
Great. And Lauren, I will actually send you who sent that as well, so that you're aware for when it comes through to you.
Yeah. So can folks hear me?
Yes, Janice.
It sounds like there's a question in the Q&A, but I can't see it.
I can't either.
So Anna, if you can see it, can you read it? And then I also saw Lisa Davis had her hand up. So Lisa, if you can we unmute Lisa or not, Angie, so that she can ask a question?
Well, I see Lisa has typed it in.
Yes,
Thank you, Lisa,
I
for
can see
typing
that.
that in.
Yeah,
and
so
I'll read
Lisa's
it.
asking.
Oh.
Oh, go. You want to do it, Ann?
No, go ahead,
That's fine.
Sue. Go ahead.
Okay. I'm just excited I can see a question. Lisa's asking, can we contact you on behalf of a hospital that we would like to participate?
So certainly reach out to us, send an inquiry, and we can certainly figure out how best to maybe reach out to that hospital to solicit interest. The application does have to come from the hospital. But certainly, if you're working through state offices of rural health and you think that there is a hospital that could benefit from our support, certainly reach out to us and we will try to make outreach or figure out how best to contact that hospital to make sure they're aware of the opportunity.
And then Eric has asked a question. If selected, how long would engagement with the TAC be likely to last? Does it depend on the applicant's needs?
So I would say we're prepared to work with hospitals for up to a year. And so that's our planning, but certainly it does depend on the hospital's need. And so if the hospital does not have need for that long of an engagement, we would certainly take that into consideration. Our goal is to tailor our approach to your needs. And like I stated, we have a lot we can offer. But certainly we'll be looking to the hospitals to direct us where they have the most need. And so again, up to 12 months is our anticipated timeline, but certainly that could be customized to the needs of the community and the hospital.
Deborah has asked, are organizations that provide health navigation and care coordination for healthcare organizations eligible to apply?
So I just want to repeat the question back. This isn't necessarily somebody that meets the definition as provided. This could be under the other healthcare organization. Is that accurate? Whoever asked the question, if you can provide other organization, is that the question? So I would say, again, not understanding fully, I would say reach out. Let us understand who you are, your scope, and then we would follow up with HRSA and the commission to identify if you're eligible or not. Without having a lot of information, that would be my suggested approach. Reach out. Tell us who you are, your thoughts, and then we can follow up with you to see if you have eligibility or not.
Marianne has asked, if we are not selected for funding, can the Technical Assistance Center still provide TA?
Our goal would be to work with you to find other potential TA opportunities. We certainly do technical assistance, through, I would say, fee for service or contractual arrangements. But certainly our goal is to qualify, folks that reach out to us through other TA programs. So if, like I said earlier, if not us, we would certainly work to see if there are other programs that you might be eligible for and would work to connect you with those other TA services.
Katie has asked, can behavioral health organizations apply? And Janice, if you want, we have talked to HRSA and they are eligible to apply for this funding. I don't know if Rachel or Suzanne wants to elaborate or not.
Yeah, similar to what Janice was just explaining on the other healthcare organizations. Absolutely submit an application. This program is meant to serve a pretty wide array of different organizations. And so, yeah, Janice and the TA team, along with my team and the Appalachian Regional Commission, will certainly be looking at each application that comes in and working to understand more about the organization and sort of how that would all work. So yes, please do submit an application.
And I am not seeing any other questions in the Q&A, but I want to make sure that Anna or anybody else is not seeing anything as well.
I am not.
Okay, well, with that being said, again, I just want to remind everybody that you can always reach out to us at the support line, and we will certainly answer those questions for you or get the answers for you. So resources and next steps. As mentioned earlier, these slides will be available to you and include the resources and links. As a reminder, you'll be able to find all of this information as well as the recording of the webinar on our website within a week of this presentation. If you have additional questions, you are welcome to reach out to us at any time via the ARH support at ARH-TAC.org. If you're not already following us on social media, I encourage you to do so. We We routinely post information that's not only relevant to rural communities in general, but more specifically to the ARH. You'll see our website here, and you're welcome to reach out to us at any time if you have questions. I will be following up with a survey link via email shortly after the conclusion of this webinar. We encourage you to participate in the survey as we value your feedback on how we can continue to serve you and answer questions you might have. Of course, a big thank you to Janice, Anna, Suzanne, Rachel, Lauren for your continued work in the rural health space and for sharing this information with us today. And last but not least, thank you to everyone for joining our webinar this afternoon. We look forward to seeing you and hearing from all of you as you go through this journey in exploring the ARH as an option for your organization. And we wish everyone a great afternoon.
So Sue, we
Yes.
did have a couple more questions come through. So before we wrap up,
Yeah,
just want to address them. So we did have a question come through that this program sounds similar to some maybe other programs that are out there. Certainly, there are a lot of TA programs out there. One of the things that we will work with applicants or folks interested in the program to understand is if they are working with anyone else, because we do have to make sure that funds are being spent to those that maybe aren't getting support elsewhere. But I would still encourage people to reach out. We can work through that with you because there are a lot of other TA programs active, and so it could sound similar, but I would hate to say somebody's not eligible, and would just encourage you to reach out so that we can have a conversation. Can somebody read the additional questions that came through?
Yeah,
Because I
can
cannot
see them now, Janice. So Katie's asking to clarify, we have to reach out to schedule a meeting, and then we would have access to the application form. And again, as Janice said during her one slide, it starts with a conversation. We definitely want to have that conversation with you to get the information and help us through that journey. And then after that, you get an intake form, which is part of that application process. And from that, we would take all of that information in order to be able to find the eligibility. Anything else, Janice, on that?
Nope, that one, that's fine.
Okay. And do you
anticipate?
Yep, Eric.
Go ahead.
Do you anticipate additional cohorts during the coming year or in future years?
So yes, certainly this is a multi-year TA initiative, and so I can't say this year. We're looking to identify, the 6 applicants we will be working with over the course of the next 12 months. There will be additional cohorts or participant years, next year. We still would ask again, if you are interested, missed the deadlines, all of that, please reach out to us. because part of also what we're trying to assess is the amount of interest in the program. So just reach out if you're not selected or don't think you'll be selected, or maybe the timing's not right. Maybe you look at these dates and think, I just can't hit that line given where my organization is at. We would still love to have a conversation with you so that, again, we can just assess interest. We certainly will be writing down and recording folks that maybe deadline or are interested to get them into that workflow for the subsequent years. So I can't stress that enough. We're eager to get it launched, working with 6 organizations. For some reason, you just can't do that. You missed that deadline. Still would love to hear from you.
I just want to again thank all of our speakers for today and participating in the webinar, and thank you all for attending today. And again, if you have any questions, please reach out to us.